memory loss, or vitamin deficiency? One test every senior over 65 must know *** introduction. When forgetfulness is more than just aging, occasional forgetfulness can be a normal part of getting older. Misplacing keys, forgetting a name for a moment, or walking into a room and pausing to remember why you went there happens to many people, especially after age 60. However, what many seniors and families do not realize is that not all memory problems are caused by aging or dementia. In fact, a significant number of adults over 65 experience memory loss due to undiagnosed vitamin deficiencies, conditions that are often treatable and sometimes reversible when identified early. Understanding the difference between age-related cognitive changes and nutrient-related brain dysfunction is critical because delaying action can lead to permanent neurological damage. The overlooked connection between vitamins and brain health. The human brain depends on a steady supply of essential nutrients to function properly. These nutrients support communication between brain cells, protection of nerve fibers, production of neurotransmitters, maintenance of memory and concentration. As we age, several factors increase the risk of vitamin deficiencies. Reduced stomach acid, which affects absorption, chronic digestive conditions, long-term use of certain medications, changes in appetite or diet, reduced intake of animal-based foods. May still develop deficiencies due to absorption problems rather than intake. Why vitamin deficiencies often mimic dementia? One of the most concerning aspects of vitamin-related memory loss is that it can closely resemble early dementia. Symptoms may include short-term memory problems, brain fog, or mental confusion, difficulty concentrating, slower thinking, mood changes, or irritability, balance problems, or numbness. Because these symptoms overlap with Alzheimer's disease and other cognitive disorders, vitamin deficiencies are frequently overlooked or misattributed to aging. This is why proper testing is so important. The most critical nutrient, vitamin B12. Among all vitamins linked to cognitive decline, vitamin B12 stands out as the most significant for seniors. Why vitamin B12 matters? Vitamin B12 plays a vital role in protecting nerve cells, producing red blood cells, supporting DNA synthesis, maintaining healthy brain function. Without adequate B12, the protective coating around nerves can deteriorate, leading to neurological symptoms that may worsen over time. Why seniors are at higher risk? Adults over 65 are especially vulnerable to B12 deficiency because the stomach produces less acid. With age, absorption becomes less efficient. Common medications interfere with B12 uptake. This means a deficiency can develop slowly and silently, sometimes over many years. The one test every senior over 65 should discuss with their doctor. The most important step in identifying vitamin-related memory loss is a simple blood test. The key test, serum vitamin B12 test. Healthcare providers may also consider methylmalonic acid, homocysteine levels. These tests help provide a clearer picture of how well vitamin B12 is functioning in the body. Why testing matters? Symptoms can appear even when B12 levels are low. Normal early detection may prevent long-term nerve damage. Testing is quick, routine, and widely available. Importantly, testing allows for informed medical decisions rather than assumptions about irreversible cognitive decline. Can memory improve if a deficiency is found? When vitamin deficiency is identified early, outcomes can be encouraging. Many individuals experience improved mental clarity, better focus and attention, reduced confusion, improved energy levels. The degree of improvement depends on how long the deficiency existed, overall health, promptness of medical intervention. This is why early awareness is essential. Other nutrients linked to cognitive health in seniors. While vitamin B12 is the most common and dangerous deficiency related to memory loss, it is not the only one. Other nutrients associated with brain health include vitamin D, folate, omega, free fatty acids. Each plays a supportive role in maintaining cognitive function, especially in older adults. A healthcare provider can help determine which tests, if any, are appropriate. Why memory loss should never be ignored? One of the biggest mistakes seniors make is assuming that memory decline is inevitable and untreatable. In reality, some causes are preventable, some are reversible. Many require early detection. Ignoring symptoms or delaying evaluation may allow treatable problems to become permanent. a balanced and responsible approach, it is important to emphasize. Not all memory loss is caused by vitamin deficiency. Not all deficiencies cause memory loss. Self-diagnosis is not recommended, however. Informed conversations with healthcare professionals can lead to better outcomes and peace of mind. Final thoughts. Protecting the aging brain. Memory is deeply tied to independence, identity, and quality of life. For adults over 65, protecting brain health means looking beyond assumptions and asking the right questions. Sometimes, the difference between decline and clarity is one simple test. If you or a loved one are experiencing unexplained memory changes, discussing vitamin status with a qualified healthcare professional may be a prudent and empowering step.